After surgery, your foot and ankle surgeon may suggest a knee walker, also called a rollabout, to help you get around. These walkers can be easier to use and help you move a little faster than crutches. If you ever used a scooter as a kid, you may find using a knee walker a little familiar. Your legs should rest on the padded seat at a 90-degree angle. Your handlebars should be at waist height. Keep your body weight forward on the pad. Don't lean back and sit on your leg, which is unstable and less safe. With your hands on the handlebars, use your other foot to scoot yourself along, just like a regular scooter. The hand brakes are either drum brakes or loop brakes. You do not need to use your foot as a brake. Make sure to take wide turns around corners, keeping all 4 scooter wheels on the ground. You may need to scoot backwards and forwards a couple of times to make especially tight turns. Always keep your hands on the brakes, especially when you're on rough surfaces like gravel, so that you can stop if you need to. Falls often happen when the front wheels hit an uneven surface and twist the handlebars. Falls can also happen if you go too fast, especially around corners and on rough surfaces. Be sure to set the brakes when you need to stand still, like when you're standing at the kitchen counter. If you have any questions, call your foot and ankle surgeon. We're here to help.